Welcome to the debate. Imagine spending your entire life savings to build a home, pouring your absolute heart into every single detail, only to have a computer algorithm run by an actuary thousands of miles away decide you are, well, simply too risky to save when the floodwaters rise. Or imagine starting a company with the noblest intentions to cure a disease, only to realize your investors require a profit margin that, frankly, forces you to price that cure completely out of reach for the people who need it most.
Yeah, it is a terrifying realization, isn't it? Because it really forces us to look at the invisible fault lines of modern business. I mean, we love to marvel at the innovation of the free market, but when the ground inevitably shakes, a really crucial question arises, like who is actually responsible for the integrity of the system?
Precisely. So today we are examining the foundational ethics of modern professions. When we look at sectors that heavily influence our daily lives, from the intense pressure cooker of startup culture and advertising, all the way to the harsh mathematical realities of insurance and healthcare, where does the burden of ethical responsibility actually lie?
Right. That's the core of it.
Is ethical conduct fundamentally driven by individual responsibility, meaning, the ethical culture shaped by founders and the discerning eye of consumers, or do the intense structural pressures of survival and profit necessitate systemic, state-level interventions to protect the vulnerable?
It really is the defining economic question of our time, honestly, and it touches, well, pretty much every single transaction we make.
Yeah, it does. So, to lay my cards on the table right up front, my position is that ethical environments are best shaped by individual accountability, structured market contracts, and the shared responsibility between buyers and sellers.
And I argue that the brutal survival metrics of modern business inherently prioritize profit over people, requiring strong public structures to prevent exploitation.
Okay, let's start right at the beginning. How business actually materializes. Because I firmly believe ethical business is deeply rooted in individual character and mutual agreements. Just consider the entrepreneur for a second.
Okay.
This is a person who takes on massive personal deprivation, huge financial risk, and often years of flat-out failure simply to offer a new product or service to society. The lessons they learn are, well, they're painful and time-consuming.
I mean, sure, nobody denies it's hard.
Right, but ultimately, it is this founder who shapes the entrepreneurial culture. It's their specific combination of personality, resilience, and management style that dictates the initial business practices and the ethical environment of their firm. And this is crucial, that principle of shared responsibility scales up.
Scales up how, exactly?
Look at broader, massive markets, like healthcare. Ethical models successfully rely on shared responsibility through multi-payer systems, which we see thriving in the US, Germany, France, Japan. In these systems, costs are negotiated and shared through deductibles and co-payments between providers, employers, and employees. It is a system fundamentally built on mutual agreement, individual participation, and the freedom to contract.
Pressures of the market make self-regulation practically a myth. We can't just look at the intentions of the founder. We have to look at the mathematical reality they operate within.
But the founder sets the tone.
They tried to, yes, but a comprehensive study by Statistical Brain shows that the failure rate of U.S. companies is absolutely staggering. We're talking over 70% of startups failing after 10 years.
Wow, 70%.
Over 70%. That massive, looming threat of ruin forces even the most well-intentioned founders to adopt what can only be described as a take-no-prisoners competitive mentality. That survival instinct inevitably leads to unethical outcomes.
I think you're...
Wait, just let me finish the thought. We see it in advertising that uses deep psychological appeal to induce wasteful consumption in, vulnerable populations. We see it in illegal practices like redlining in the insurance industry, and we see it in the enormously expensive medical care and prescription drugs in the U.S., which leaves citizens exposed and completely unprotected compared to the single-payer systems operating in the UK and Canada. The pressure to survive simply overrides individual character.
Okay, that 70% failure rate is exactly where we should start digging in, because I really think you're framing failure as an excuse for bad behavior. rather than the crucible that actually creates value.
It's not an excuse, it's a mechanism. Just think about the sheer terror of being a founder for a second. Look at what happens at the 5-year mark. Over 50% of startups have already collapsed. If you are a founder staring down a rapidly shrinking runway, and your venture capital backers are demanding like a 10x return on their investment to satisfy their own algorithmic portfolio math, your primary mandate isn't ethics.
Well,
it is revenue. It just is. And to drive that revenue, to desperately build brand awareness, startups aggressively turn to the advertising industry. But here is where the ethical line gets crossed. The mechanism they rely on isn't information, it's psychological manipulation. They intentionally design campaigns to artificially bolster consumers' self-esteem. But, only conditionally, only if you purchase their specific product.
I see why you think that. But let me give you a different perspective. Advertising, at its core, is merely a map.
A map?
Yes, a map. It plays a highly useful, highly necessary role in mapping the terrain of a free market, informing consumers about new or modified products. Without that map, innovation dies in a vacuum. Yes, the manager's task is to create campaigns where truthful content is prioritized, but we absolutely cannot remove the agency of the consumer from this equation. The ethical responsibility falls on the wise purchaser to navigate this map with a discerning eye.
But it's not a topological map, is it? It's a map drawn by a carnival barker where all the roads mysteriously lead to the gift shop.
That's a bit cynical, don't you think?
It's realistic. A discerning eye assumes a level playing field, which frankly ignores the reality of modern advertising mechanics. We aren't just talking about a straightforward billboard listing the features of a new vacuum cleaner here. We are talking about subliminal advertising, embedded words, highly targeted algorithmic imagery, and psychological triggers that bypass the prefrontal cortex and reach us beneath the level of our conscious, rational scrutiny. How does a wise purchaser use a discerning eye against a message they don't even know their brain is processing?
Okay, I'll grant you that algorithms have made marketing much more targeted. But to suggest that modern marketing operates on the level of subliminal mind control, that strips the average citizen of their basic autonomy.
I'm not saying it's mind control. I'm saying it's asymmetric warfare of information. And the very young and the very old are particularly ill-prepared to exercise good judgment in the face of these tactics. When a company is desperately trying to beat that 50% failure rate, they don't treat the consumer as a rational actor to be informed. They treat them as a psychological vulnerability to be exploited.
Look, yes, the very young require safeguards, obviously. No one is arguing that toddlers should be treated as rational market actors.
Glad we agree on that.
Right. But for the vast majority of commerce, the contract between buyer and seller requires the buyer to actually exercise judgment. The map might be brightly colored. It might be heavily stylized by that carnival barker of yours, but it is still the consumer who chooses to pull out their wallet and take the journey.
Yeah, but that wise purchaser logic breaks down when we aren't talking about buying, a luxury watch off a targeted Instagram ad. It breaks down when the product is something you literally cannot survive without. This is where market logic violently collides with human necessity. Let's look at the insurance industry, for example, where the product is mandatory protection against catastrophic risk.
Well, insurance is fundamentally about assessing and pricing risk mathematically. That's just how it works.
Exactly. And how does the private market organically assess that risk? By drawing lines that exclude the vulnerable. Look at the history of redlining. This is the discriminatory and usually illegal insurance practice of denying certain coverages in specific neighborhoods or selling them at vastly higher prices.
Wait, hold on. But redlining is widely recognized and prosecuted as an illegal aberration. It is not the standard operational goal of insurance.
It is legal now, yes. But we have to understand how and why it happened in the first place, because the underlying mechanism is still what drives the market today. Actuaries look at zip codes, they look at historical claim data, proximity to fire stations, the age of the infrastructure, and they mathematically deduce that the propensity for accidents, burglaries, or fires is higher in certain areas. So the algorithm prices those people out.
Because the risk is higher.
But this proves that the market's inherent instinct, its basic mathematical function, is to abandon the vulnerable when assessing risk. When the math doesn't favor the corporation abandons the community.
I'm just not convinced by that line of reasoning because you are completely conflating mathematics with malice. Let's examine how insurance actually works on a mechanical level. An insurance policy constitutes a form of contract between insurers and the insured based on risk pooling. If you pool 100 people and 90 of them live in a severe floodplain, the pool will inevitably go bankrupt the moment a storm hits. It is a mathematical reality, not a moral failing.
But what happens to those 90 people?
If a carrier cannot secure a reasonable profit, they cannot accumulate the financial reserves necessary to actually pay out the claims when the disaster strikes. If we force carriers to take on catastrophic risks without charging adequate premiums, the entire system collapses, and then literally no one has coverage. The ethical expectation must apply fairly to both sides, what we might fairly expect from carriers in terms of payout and what premium policyholders ought to be charged for sufficient coverage.
A fair market contract requires equal footing, though. If your home is in a vulnerable area and the private market tells you the premium to insure it is half your annual salary, that is an eviction notice signed by an actuary.
It's the cost of the risk?
That is exactly why the private market alone cannot ethically handle disaster. It justifies a much larger role for government. We have to manage disaster insurance through private and public partnerships, like FEMA and the National Flood Insurance Program, because public tax revenues must step in to subsidize the mathematical failure of the private market.
It is indeed the ultimate test of our models, and I would argue healthcare clearly demonstrates the efficacy of shared responsibility and market innovation.
I'm sorry, but I just don't buy that. Let me tell you why. The multi-payer healthcare system you champion is fundamentally broken. If you're listening to this and you've ever tried to read an explanation of benefits from your health insurer, you know exactly how convoluted this gets. Medical care and prescription drugs in the United States are enormously expensive precisely because of the friction in the system.
No, they are expensive because the U.S. is funding the vast majority of global medical innovation. We are paying for the R&D that the rest of the world benefits from.
No, they are expensive because we have a multi-payer system that inserts layers of private entities between the patient and their care. You have insurance companies, and then you have pharmacy benefit managers or PBMs, all of whom need to extract a profit margin from the supply chain.
Wait, let's pause on pharmacy benefit managers for a second, because I think a lot of listeners just see their doctor, get a prescription, and go to their pharmacist. They don't realize there's a middleman negotiating all of this.
Exactly. PBMs were originally designed to process claims and negotiate lower drug prices with manufacturers on behalf of insurers. But because they operate in a profit-driven market, the mechanism warped. Now they often negotiate massive rebates from drug makers, but they don't pass all those savings down to the patient at the pharmacy counter. They keep the spread as profit.
Well, they provide an administrative service.
This is a system where a patient, an employer, a private health insurance company, and the PBM are all tangled together extracting value from a sick person. Compare that to a single-payer healthcare system, like the ones in the UK and Canada. State or national tax revenues pay for citizens' medical care, with the government being the sole payer. It eliminates that entire layer cake of profit-driven friction.
Look, I see the appeal of single-payer simplicity on a whiteboard. I really do. But the reality is much more complex. I rigorously defend the multi-payer model because it balances access with unparalleled innovation. And we have actively managed these costs within our framework using market mechanics. Just look at the past 35 years. The generic drug program established that the FDA has saved consumers trillions of dollars.
But how does it actually help the patient who can't afford the drug while it's still under patent?
By honoring the patent, we incentivize the initial billions of dollars in research required to cure the disease in the first place. But once that patent expires, the FDA mechanism floods the market with alternatives, driving prices down organically through private market competition. We don't need a single-payer monopoly to lower costs. We need well-structured market incentives.
But even with generics, those drugs are still dispensed within a system that requires a patient to assume a massive annual deductible before full insurance coverage even applies. They still have to pay a copayment, I mean, if you're deeply ill, a $5,000 deductible is an insurmountable barrier to wellness.
And that is exactly where the Patient Protection and Affordable Care Act of 2010 comes into play. The ACA is a prime example of a comprehensive federal healthcare management system that effectively addresses these gaps without destroying the private market.
By forcing people into a flawed market.
By structuring the market ethically through mandatory risk pooling. The ACA forces a balancing of the mathematical scales. It requires younger, healthier people to participate in the market to subsidize the care of the older and sicker populations. It is funded by a combination of payments by those enrollees and supplemental federal monies earmarked specifically for this task. It is a brilliant hybrid approach. It retains private innovation, it retains the concept of an individual premium and shared responsibility, but it provides safety nets. It proves that a system relying on market contracts is practically and ethically superior to concentrating all administration into a single, sluggish state agency.
That's a compelling argument, sure. But have you considered that the ACA is essentially putting a Band-Aid on a fundamental structural flaw? It is trying to regulate an industry that at its core views human illness as a revenue stream. When you have an entity whose survival depends on maximizing premium intake and minimizing claim payouts, you are inherently setting up an ethical conflict of interest. The ACA merely subsidizes that conflict. A single-payer system aligns the motive of the payer with the health of the citizen. The goal is simply wellness, not a reasonable profit.
But reasonable profit is the engine. It is the mechanism that builds the state-of-the-art hospitals, develops the MRI machines, and researches the mRNA vaccines. If you eliminate the profit, you eliminate the very capital required to advance medical science.
The UK and Canada still have advanced medical science. They just don't have citizens mortgaging their homes to afford insulin. And I think this comes back to the overarching philosophy we've been circling today. The harsh realities of the market, whether it's the algorithmic reality that a founder has a 70% chance of ruin, the mathematical tendency toward algorithmic abandonment and redlining, or the sheer crushing expense of American healthcare, all point to one conclusion. You simply cannot rely on individual accountability when the system itself demands ruthless behavior to survive. Structural state safety nets are absolutely essential to mandate ethical outcomes, because the market, left to its own devices, will always prioritize its own survival over the public good.
And I return to the idea that from a founder's entrepreneurial culture, to the contract of an insurance policy, all the way to the mathematical risk pooling of the ACA, individual responsibility and structured market contracts form the most robust ethical framework. When we rely solely on the state to insulate us from all friction, we lose the innovation, the drive, and the accountability that pushes society forward. A system without risk is a system without progress.
Well, we certainly agree on the omnipresence of risk. I mean, whether it's the staggering failure rate of startups or the utter devastation of natural disasters, the modern professional operates under immense pressure.
Indeed. Finding the balance between securing a reasonable profit to keep the doors open and the lights on while still serving the public good is perhaps the most profound ethical conundrum in business today.
It really is. And it requires looking at these professions through both a micro lens, understanding the personal deprivation and ambition of the founder, and a macro lens, seeing the sweeping systemic effects of their creations on vulnerable populations. There are incredibly complex nuances to business ethics that demand we constantly question our default assumptions about how markets function.
Which brings us back to our house built on the fault line. Whether you believe the structural integrity comes from the brilliance and responsibility of the architect's individual design or the strict mandate of the city's zoning laws, it is clear that building in today's environment is fraught with peril and requires constant vigilance. We will leave it to our listeners to form their own conclusions on where that foundational responsibility truly lies. Thank you for joining us on The Debate.